Have you ever been to physical therapy before and felt like it didn't work for you? Maybe you went for a while, maybe twice a week for a couple of months, and they gave you exercises to do in the clinic. They made sure you were doing them correctly. Maybe they gave you a home exercise program to do, and you just still felt like you didn't improve much or at all. If that has happened to you, it's probably because you were seeing a general orthopedic physical therapist and not an MS specialized PT. And let me tell you, there is a huge difference. And I know this because I used to just be an orthopedic physical therapist before I became a specialized MS physical therapist. Orthopedic physical therapists are typically the best type of PT to go to if you have a sports-related injury, if you have general weakness, poor balance, or even after a surgery. However, it's not the best type of PT to go to if you have MS because there are a lot of differences in the type of treatments. So I want to touch on those differences just to educate you on the differences, and therefore you can make a more educated decision when you are trying to find a PT to help you reach your goals. My name is Dr. Gretchen Hawley. I'm a physical therapist and multiple sclerosis certified specialist. I created this page to help give you tangible exercises and strategies that you can implement to help you champion your life with MS. There are three main differences between an orthopedic physical therapist and an MS specialized physical therapist. One of the biggest differences is the type of exercises. But before I touch on that, I want to touch on the other two. The first one being fatigue. Fatigue, as most of us know, is a huge issue with people who have MS. Fatigue is one of the most common symptoms that people with MS suffer from. And there are two different types of fatigue, which I touch on in a different YouTube video. However, it is so important to acknowledge that fatigue exists and also that you should not push into fatigue. An orthopedic physical therapist will often have you do exercises and keep going until you must stop. Whereas in reality, when you have MS, that is not what you should be doing at all. Oftentimes, when you push into fatigue, you actually are having poor quality because you're tired, and that poor quality is exactly the opposite of what we want. When you're working with an MS specialist, we are constantly asking you about your fatigue levels, probably so much so that it's annoying to you. But it's really important because if you're getting fatigued, the quality is not going to be as good for the exercises, and then you're training your brain for bad quality. Sometimes you might not even feel fatigued, but we can see that the quality isn't exactly where we want it to be, so we will stop you early. It is a big difference between pushing through as many as you can do and stopping early. And with MS, it's so important that you stop right before the fatigue kicks in. The second thing that orthopedic physical therapists often don't take into consideration is heat intolerance. It is so important to understand that heat intolerance occurs in people with MS not only because of the temperature outside, but because your core temperature is rising. Your core temperature only needs to rise by half of a degree. That's so little. Half of a degree rise can make heat intolerant symptoms come on. And oftentimes, something that causes heat intolerance is exercise. So, if I know in advance that my client who's coming in has heat intolerance, I will often give them a cooling vest or cooling wristbands or some type of cooling device to put on before we even start exercise to hopefully reduce or even prevent heat intolerance from kicking in at all. Whereas when you don't have that education behind heat intolerance and what causes it and how that might look like once it does come on, such as blurred vision, poor quality of exercises, worse balance, worse walking, can't lift your leg up as high. If you don't know that, you won't know what the cause is, and it's almost harder to backtrack and try to reduce those symptoms. An MS specialized physical therapist typically has the knowledge of what heat intolerance is, what causes it, and strategies to prevent it from coming on or reduce it as soon as it starts coming on, such as taking cold sips of water as well as cooling devices. And the third thing that makes MS specialized physical therapy different from orthopedic physical therapy is the type of exercise. Orthopedic physical therapy exercises are typically geared towards strengthening the muscles for the joint that is weak. For example, if you have knee pain or hip pain, a very common type of exercise might be the straight leg raise or the side lying leg raise. And these can be done for pain or weakness, but they're not very functional. If you've ever been to PT, you likely have done those exercises before, and you know that both of those are in a lying down position. What someone with MS might experience is you improve your strength with those exercises lying down, but you go to stand up and those hip flexors that just gained so much strength in a lying down position have zero strength in a standing position. And that's because those exercises are not functional for things like walking. So you might have full strength with exercises on the ground, but you still don't walk any better, or your balance still isn't any better. So with MS specialized exercises, the most important thing is that they are functional, meaning if you have a goal of walking better, we break down the different exercises that build up to walking. Walking requires 7 different movements. So your exercises will be those 7 different things, not necessarily recumbent bicycle riding or straight leg raises or the clamshell exercise. Those are good exercises for other reasons, but they're not functional, and therefore they won't help with walking. One common exercise that a lot of people do in the PT clinic is recumbent bicycle riding, where you're sitting back and you're riding a bike. Maybe you're using your arms too. And that's a great exercise for cardio, but it won't help with walking because you're in a seated position. You might improve your strength in that position, but again, it won't help with walking. It won't help with stair climbing. It won't help with getting into and out of the car. With MS Specialized PT, all of your exercises should be broken down from the goals that you want to do. Walking, stair climbing, getting out of bed, getting into a car, things like that. I would encourage you to try to find an MS specialist physical therapist near you. This can be tricky as that there aren't many of us around, but you can start with searching through the National MS Society or the Consortium of MS Centers, or calling around to the different clinics near you and asking if they have a PT who is an MS specialist. Another type of specialty that is different from MS specialization is a neuro-certified specialist, or NCS. And this is a great secondary PT to go to. MS physical therapy would be the best one. However, a neuro-certified specialist is a great backup option because they do have more knowledge typically on MS than an orthopedic physical therapist. A neuro-certified specialist has so much knowledge on all things neuro, not just MS. So because of that, they might not know all of the nitty-gritty details as an MS specialist would. I am offering telehealth physical therapy for people with MS if you are living in the states of Maine, New York, or Massachusetts. And if you don't live in those states, I developed an online MS wellness program called The Missing Link. And in The Missing Link, I have pre-recorded videos of myself giving all of the exercises that are MS specific and based on neuroplasticity, as well as symptom management videos, guest speaker videos every month with other MS experts, and research update videos with yoga. If you want to learn more about The Missing Link to see if it would be a good fit for you, there is a link in the comment section below that you can check out and learn more about it. I hope you enjoyed this video. Please be sure to find a PT in your area or online that specializes in MS in order to get the best care and have the most likelihood of improving your strength, your balance, your walking. If you have some extra time, feel free to check out some of these videos, and please remember to press the thumbs up button, press subscribe, and share with a friend.